Looking at the problem right away, it asks which parts of an ultrasound image are affected when refraction occurs. If we draw a basic diagram, a difference in speed occurs at the edge of a curved surface, which can result in shadowing. In this way, the darkened area may lead to misinterpretation of the lateral position on the side, rather than changes in the image along the same axis. The correct answer would be option B. You can think of it as being related to identifying abnormalities in the lateral position. The important point is not to overthink it. If the keyword refraction comes up, remember well from this question that it is most closely related to the term lateral blurring. Similarly, since refraction is a frequently appearing pattern, I want to emphasize it again. Let's move on and look at the next question. If you look at the question, it asks you to find which structure in the ultrasound image shows the most attenuation. Since it's not difficult, let's go straight to the answer. In the case of gallstones in option B, since they are composed of hard stone material, the ultrasound beam cannot pass through, resulting in shadowing behind them. So, you should select option D as the correct answer. Next, let's move on and look at question number 93. For this question, let's find the answer right away by using the related keywords. Expressions related to specular reflectors include normal incidence or perpendicular, for example. The correct answer would be option C. For this type of question, rather than analyzing each detail and interpreting them one by one, it's more efficient to immediately find the matching terms, as I can explain. Next, let's move on and look at question 94. If we interpret the question, it's about performing a thyroid ultrasound and choosing the most appropriate frequency transducer. Yes, since it's a superficial organ, a high frequency should be used. So, among the options, the highest frequency is 10 MHz, which is option B. I've explained this type of question in previous lectures as well. The frequency used in actual clinical practice may be different. Also, although there may be differences between hospitals, it's more efficient to clearly understand what the question is asking and approach it by thinking, since it's a superficial organ, I should use a high frequency. For example, you might think, a hospital uses a 5 to 7 MHz probe, so that must be the correct answer. But it's important to carefully understand the main point of the question and choose the right answer accordingly. I want to emphasize this. It's best to approach clinical practice and theoretical concepts separately. Next, let's move on and look at question number 95. If you look at the question, it asks about what kind of interaction occurs between the ultrasound beam and the structures inside an organ. Basically, the concept of reflection can be related here. For the outer parts, for example, if you have a kidney, the areas outside the kidney may exhibit specular reflection due to their smooth surfaces, but the structures inside the organ are made up of actual substances. Since these can include non-uniform elements, overall you can consider that scattering occurs. Also, among the internal structures inside the organ, blood vessels can be included in this part. Inside the blood vessels, Rayleigh scattering and similar scattering effects can also be related, so this would be the correct answer. The rest are unrelated options. These two options can be confusing, but if we consider the structures inside the organ, we can conclude that scattering is more relevant. Next, let's move on and look at question 96. This question contains the most fundamental and important content. This question is asking what kind of interaction is necessary between sound and tissue for an ultrasound image to be created. When there is a liver, the ultrasound image can be produced due to the reflection phenomenon caused by the difference in acoustic impedance between different tissues. The correct answer would be option C. At the very least, if you are studying ultrasound imaging, you should understand the mechanism by which it is created, and you can use this question to help reinforce your memory. Next, let's move on and look at question 97. This question asks you to choose the factor related to acoustic impedance from the options given. Acoustic impedance is determined by multiplying the density in option B by the propagation speed, which gives you the acoustic impedance. So the related answer is option D, which includes density, so you can select that one. Next, let's move on and take a look at question 98 right away. If you look at the question, it asks about the two factors that can cause specular reflection. The first is the most basic type of reflection, so there must be a difference in acoustic impedance. Secondly, the angle at which the wave enters is also an important determining factor. The correct answer is option A. You can choose this option, which explains the difference in acoustic impedance and the angle, as the correct answer. Moving on, let's look at question 99. If you look at the question, it asks you to select the option that increases together with attenuation. If you look at each item, path length is a factor related to how far the ultrasound beam can travel. The higher this value, the farther it can travel. Naturally, since it reaches deeper areas, it can be considered a factor that increases together with attenuation. If you look at the second point, in the case of absorption, the more absorption there is, the weaker the intensity of the ultrasound becomes, so attenuation also increases. The third point is a basic factor. As the frequency increases, the ultrasound cannot travel as far, so attenuation also increases accordingly. In the case of the fourth point, if there is a large difference in acoustic impedance, there will be a lot of reflection. Attenuation will also increase accordingly. From point A to point D, all of these are factors that increase together as attenuation increases. The correct answer would be to choose the second point. Now let's move on and look at question number 100. If you look at the question, the content is a bit long, but what it's asking is actually quite simple. You just need to pay attention to the last line. It's asking you to choose the probe frequency at which attenuation occurs the least. Among these, to minimize attenuation, the lower the frequency, the better. This is because higher frequencies can't travel far and experience more attenuation. Among the choices, you can select option A, which has the lowest frequency. What you can learn from this problem is that, while the earlier part is important, the most crucial point is at the end. So, as long as you clearly identify what the question is really asking, you can solve even lengthy problems without much difficulty. Please keep that in mind. With that, we've solved up to question 100.